Thanks so much, Angela, for that introduction. So I'll start by sharing my screen. Just give me a second here. And just a quick confirmation, you can see the screen in full and can hear me okay?
Yes.
Right. Okay, great. Thank you so much for inviting me to present today. I'm going to talk today about wildfire smoke communications. So we often think about wildfire smoke, and in public health, obviously communicating risk is important. And so through a series of projects that I'm going to present today is some work we've done in this area. And I want to say thank you. There we go. Thank you, Angela, for the land acknowledgement. And in addition to your land acknowledgement, I too am in Vancouver on the Coast Salish territories. And when we think about wildfire smoke, want to give thanks for the protection and stewardship of those lands from the Indigenous peoples in BC, particularly their knowledge of the lands and how to protect them with respect to wildfire smoke and wildfires in general. And just a further reflection from your land acknowledgement. So thank you very much. And so a quick agenda. This seems like a full agenda, but I promise you it is brief. Just a little bit more about Airway Legacy for Airway Health, the program that I work for, how we got into wildfire smoke communication and messaging and research around that. And then a series of projects that we've done on wildfire smoke communication. And then I'll talk a little bit about other related projects we've done that are sort of a little bit tangential and next steps that we're thinking about in this area of research. So Legacy for Airway Health, as Angela mentioned in the introduction, is a donor-funded program, and we're housed within Vancouver Coastal Health Research Institute under the Center for Lung Health. And through this generous donation, we have been able to build capacity in creating partnerships, and we use an integrated knowledge translation approach. Our work and research focuses on COPD and asthma in prevention and caring for individuals living with and at risk for COPD and asthma. So we take a integrated knowledge translation approach and as well as a patient-oriented research approach. And so I'm just going to go to the next slide and we'll share a little bit more. So the wildfire smoke communications fall under our sort of prevention lens. And we do have a pillar of improving care for people living with COPD and asthma. And the improve pillar really focuses on doing work with the health authority and with healthcare providers. Whereas the prevention, we focus more on environmental exposures, as Angel mentioned, wildfires, and another pillar of our work is around smoking cessation and vaping cessation. And you can see right in the center there, our work is always centered around communities and patients. And we have a community partner committee made up of around 20 individuals caring for or living with COPD and asthma. And these patient partners help to inform us on all of the work that we do. So they serve to be, I shouldn't say they serve, they partner with us in research, so act as partners on our research project, help to inform our questions, and help to develop lots of tools and information that we provide, as well as really embedded within our research. And another pillar here is enable. A large portion of our work is focusing on enabling partnerships, leadership, and capacity. And really a highlight here that I'm going to talk about and focus on related to wildfire smoke is these partnerships, is building relationships with government sector, with health authorities, and with other researchers and community organizations. So as a plug for patient-oriented research, I'm not sure if any of you have participated in patient-oriented research before or know very much about it, but I'm just throw out the question there: what role can patients play in? I think this is the wrong. Angela, I'm not sure about this. Oh yeah.
Question Sorry, one. I have
okay. Okay. Yeah. Yeah. What role can patients play in research and care improvement initiatives?
I have stopped poll and share the results now.
Okay, thanks, Angela. So I see the results, and almost everyone said real life experience, and that is absolutely correct. That is why patients want to be involved in research, or one of the reasons is sharing their lived experience, which can be with the healthcare system, symptoms, self-management, to help researchers and care improvement initiatives understand their experiences in order to improve them. If we don't really understand what patients are experiencing, it's very difficult to actually take action and do work to improve them. But also, this was, and I didn't mean for it to be any trick question. It's all of the above. If patients have interest in skills in data analysis or project management, those are skills that they can contribute. Really, what we want to emphasize here is that patients are whole people. They're not just people living with their condition. They're not only their condition. So they're able to provide any skills that they have, or interest areas that they have. And we have had participants or patients play a role in all of these, less so in data analysis. But one thing that is common is for patients to reflect, to review the data and make sure that it makes sense to them as well. And yeah, I'll move on. I'm not sure how to make the poll go away. Okay, there we go. Okay, so that was just a little intro to patient-oriented research. This is really a focus of our work at Legacy for Airway Health, and all of the projects that I'm going to present to you today involve patients as partners in research with us. And so this first slide is really, how did Legacy for Airway Health get started in wildfire smoke communications? And it started way back in February of 2020, which feels kind of like eons ago. We partnered with the BC Lung Association, now known as the BC Lung Foundation, at their annual Air Quality and Health Workshop, which was in person at that time, and they're back to being in person. And this is an opportunity where many organizations from across British Columbia gather to talk about air quality and health in British Columbia. And so we partnered with them and had a workshop to have discussion around pretty much like sort of what are the hot topics and what is really of interest, and what are the gaps in research that can be addressed. And through subsequent conversations in the months following this, we identified that wildfire smoke, in particular the communications around this, was a gap in understanding, particularly in British Columbia. And after doing some literature searching, there really is very, very limited evaluation or understanding of how wildfire smoke communication and messages are received. So public health agencies across the world send out communications around, we heard them from COVID, wildfire smoke, heat alerts, but there has been actually very little research and understanding on how or whether the public understands or receives these messages. And so we set out to find out and do a bit of an evaluation. So I'm going to do another poll. And this past summer, you probably saw if anywhere in Canada, I think, had some sort of air quality alerts. So this was a survey question that we asked participants across BC. So how do you find out about wildfire smoke alerts in your area? Okay. So I think you can see the results. So lots of people get an app notification. That was the top answer, I think. Social media, news stories, and then watch or listen to the news. So this is, I think, an important thing as a person working in public health to know how people are actually receiving messages, because there's a lot of energy, effort, and resources that are allocated to sending out public messages. So it's really good to know how people are actually receiving them. And so I think different demographics. So as we found in the research that we did, which I'll talk about in just a moment, that there's a variety of ways people receive messages, and it varies based on sort of more demographical information. So I'll end the poll there. Okay, so as I alluded to, in the fall of 2020, we did a public survey on wildfire smoke communication. So as I alluded to, we co-developed this survey. We had patients involved in developing the survey questions. We also partnered with government agencies like the BC CDC. And our aim was to understand how people in BC receive and understand wildfire smoke messages, and if they're actually able to implement any of the public health advice that's provided. And I don't know if any of you remember, based on the past few years of bad wildfire seasons, in 2020, we actually had a very sort of low wildfire season, except for in September, we had a bout of wildfire smoke that came up from the Western United States. And in the Vancouver area, we actually had wildfire smoke, I think it was for around 10 days. And pretty much all of the province experienced at that time wildfire smoke, and in the absence of wildfires. So this is actually really good timing for a survey on wildfire smoke communications. And we had 757 people from across British Columbia respond to this survey, which were largely representative of the British Columbia population. If you're interested in the full results of this survey, there you can scan the QR code for the full publication. And some key findings from the survey: that the public receives messages from diverse ways, including websites, social media, radio, and TV. And that Indigenous people, trade workers, and rural communities rely more heavily on radio than other people in British Columbia. And these are important things for government agencies to be aware of. As I mentioned, that there are lots of resources given to sending out messages. And so knowing that these efforts to send out in diverse ways is important, so that those resources can be maintained for future messaging. As we know, wildfires will continue to get worse in the future, and we had it particularly bad and are having a bad year this year. The public had some suggested improvements for ways to optimize wildfire smoke messages for British Columbia. Some of the ideas that came out were special air quality reports by local news outlets. So, for example, things like on like a 6 o'clock news, having a time during that period that's always dedicated to air quality reports, or in like a local newspaper, a section in the newspaper around air quality on a regular basis. Other suggested improvements was simplified, tailored, and more frequent messages. And this was something that was consistent in other projects as well. And the frequency of messages should be sort of increased before and during wildfire season. And then the last thing that we kind of knew as a limitation before going into the survey is to translate the wildfire smoke alerts into various languages. So they're currently, I believe this is still the case, only published in English, which can be a challenge for non-English speaking people to understand the public health advice given and then to be able to actually implement it. There are fact sheets and lots of information that is translated, but the actual like active alerts, as far as I understand it, are only published in English. So I'm going to do the third poll here, and just to see if you're still awake at lunchtime. What is an important method for communication in rural communities? So the 4 listed here are different ways people receive messages, but what was most important for rural communities?
I've stopped the poll, Erin.
Okay, thanks. So most of you were paying attention. Radio was the most important way for rural communities, Indigenous communities, and trade workers that they reported receiving wildfire smoke communications, which is an important reflection for disseminating public health information from the standpoint of government partners. So just like the overall message here is that public health messages should be disseminated in diverse methods to reach different types of people across the province to support protection of health. Okay, and so we finished this survey. We've got some really good results from the public's perspective of wildfire smoke communication, how people receive, understand, and if they're able to implement wildfire smoke messages. And so the next part of this work is we wanted to reflect on how do we get this information in a meaningful way to government partners in order to actually implement and make changes to optimize wildfire smoke messaging in Canada. So with funding from Health Canada, we conducted a two-part workshop. This was a virtual workshop in February of 2022. We had 69 individuals attend, and there was representing 30 organizations from across Canada. Now, well, I say across Canada, most of them were from BC, but there was representation from most other provinces across the country. And so we talked about the results from the survey and ways government organizations could optimize and barriers and challenges that they might face in optimizing wildfire smoke messaging. So the four sort of large categories were as challenges were coordination, data needs and evidence gaps, message content, and message delivery. And so coordination, as someone sort of outside of this scope, was actually surprising to me. From my perspective, it seemed like there was good coordination. But one of the things that came up was increased clarity of identifying roles and responsibilities between different jurisdictions was something that was identified that needed to be improved. And not just in wildfire smoke communications, but sort of across the board in other work that I've done is creating a one-stop shop for information and resources. We hear in Legacy quite often that having resources, information on so many different websites and from so many different agencies actually makes it really more challenging for people in the public to get information that they need from one source. And then the second part, data needs and evidence gaps. The data needs are sort of twofold. One part is air quality monitors, so increasing the resolution of the network, so more air quality monitors. In Canada and in BC, we have a lot of very rural areas that don't have regulatory monitors that are particularly close to local communities, and that makes it challenging to really understand whether the public health advice is applicable to them or not. And evidence gaps was another part, and this is an ongoing challenge with research and evidence, is that we don't really have a good understanding of when people should be staying inside, because everyone has sort of a different level of risk. So for example, like a child with asthma might need to stay inside during a wildfire smoke event, or someone who's elderly. But for a person going outside to exercise, what is the risk balance of going outside to exercise versus staying inside? And when we're thinking about sort of holistic health, how do we balance sort of isolating ourselves inside socially and mental health challenges with the health risks of going outside during wildfire smoke events? And while in Vancouver, the events are often like relatively short, and we can just sort of hunker down for a couple of days. In places in the interior and other parts, it can last for weeks or even the whole summer. And so to tell people to stay inside all summer is just really not a realistic public health message. So these kinds of things are, there's more data and understanding of the health risks and benefits and balancing those that need to be understood. The third one, message content. So this is a bit of a comprehensive statement, but And the workshop participants basically defined message content. It should be creative, customized, actionable, and simple for diverse people and places. So that feels like a lot, but essentially we want to like personalize and tailor messages to people based on the risk, and create them, make them simple so people can understand and implement them. And then lastly, message delivery. So make a delivery plan or message delivery plan that is timely and sustained with consistent messages. So we heard during this workshop that between organizations, sometimes messaging gets slightly confused, or there's slightly different nuances in the messaging. And also this being timely has come up in all of our conversations. The more frequent messages are needed. And last one was using diverse and creative modes to reach diverse people and places. So again, that's a reflection of all those various ways that the public receives messaging, and that should be maintained and even expanded to different ways of communicating with the public. And if you're interested in learning more about this engagement project from Health Canada, there's a report using this QR code. And if anybody wants me to come back or something, just let me know. And so I didn't actually name any specific organizations, but what types of organizations do you think are involved in wildfire smoke communications in British Columbia and across Canada? Okay, so yeah, all are correct. And this actually makes it really challenging in developing wildfire smoke communications, because there are so many different organizations with different jurisdictions and different authorities involved. So that is in part why it's a challenge to optimize wildfire smoke communications, is because there are all of these different players involved. So for example, the Ministry of Environment and Climate Change Strategy is responsible for the actual air quality data collection, so understanding what our air quality is. And then health authorities are responsible for the public health messaging part of that. So they have to combine their resources and the relevant jurisdictional areas into creating these public health messages that combine the air quality alerts and the public health messaging, and then distribute those to journalists, media, etc., public health practitioners, and in creating clean air shelters and things like that. So it becomes a challenging web of people and jurisdictions and responsibilities, which is the complex part about public health communications. And so how do we make sure that the public gets the right messages at the right time? And so the third part of this work that we did was, so we did this public survey, and then we engaged government organizations in understanding ways that they can improve or optimize their public health communication strategies. But what we really wanted to know is, in this third project, was that workshop, was all this worth it? Were any changes actually made? So we did an evaluation of the workshop. So we did a series of 3 surveys, one in February of 2022, like right after the workshop, in May of 2022, so sort of pre-wildfire season, and then a post-wildfire season survey in September 2022. And you may or may not recall, but last year in September was actually more like our peak part of our wildfire season. We had a very late wildfire season. And so unfortunately, we didn't get as many responses as we were hoping to the September survey. And we think in part because people were actually doing the work of communicating wildfire messaging during that time. And but unfortunately, we had determined our timing survey priority. And so we shared this survey with people who attended the workshop. So as I mentioned in the previous slide, there was 69 individuals who attended across 30 organizations. And when we were developing these surveys, we used the REAIM and PRISM frameworks for our evaluation framework. And sort of high level results that I want to share here with you today. This is currently under review for publication, but some high level results to share with you today is that in creating the report in combination with the workshop participation, so those two items together were helpful for organizations to consider what actions that they should take as an organization to optimize wildfire smoke communication. So really understanding what their lens and their role within the landscape of public health is. And that the survey respondents reported that the most common intention to take and the actual most common action that was taken from these workshops was simplifying message content. And so kind of what we found was that from these reports or from these workshop, that this really enabled organizations to address sort of these low-hanging fruit, but that system level issues persisted that needed additional resources. And so some of the anecdotes that we found from the survey results were that during wildfire season, oftentimes processes went back or reverted to previous processes. And a major issue everywhere in healthcare is capacity. So the ability to actually change and improve processes is a really big challenge, particularly during wildfire season. So these are sort of things that need to happen in the winter time, but even so, it was reported that the amount of capacity is just so limited in our health systems and in our government to do this type of optimization work that there really needs to be additional resources allocated to this optimization. And lastly, I just want to bring sort of a higher level issue here is that something that we reflected on as we were doing this evaluation is that there's not really a closed loop of understanding. So if a government makes a change, in their wildfire smoke communication, we don't really know if that positively or negatively impacted the awareness of the public or their ability to act on the advice. And so we need to do a little bit more of evaluation of understanding how changes to wildfire smoke messaging actually impact public health. And so our high level conclusion here is that there's still lots more to understand on how to improve and evaluate the actual messaging. And so when we think about messaging, we're really thinking about how do we protect people, protect public health, because that's really the ultimate goal of public health messages is for people to be able to take action to protect themselves from the wildfire smoke itself. And so we've done this additional project. It was a cost effectiveness project and retrospective to understand if HEPA air filters, so like an air cleaner, would prevent wildfire related asthma complications. So that would be like salbutamol dispensations, like pepper dispensations, or emergency department visits. And largely, we found that it was cost effective, but variable by region. So meaning that places that experienced more wildfire smoke, it was more likely, it was more cost effective. And so this is actually a really novel type of research. Oftentimes cost effectiveness work looks at the cost effectiveness of medications. Rarely does it really look at the cost effectiveness of from an exposure like wildfire smoke. And so there's really some unique and interesting applications that we could expand on this work. And we know that HEPA filters are good at cleaning the air, but they're cost prohibitive for many people still. So whether a hypothetical government program would help, we know that the First Nations Health Authority in British Columbia actually has a distribution program of air cleaners. So in some ways that exists, but we reached out and we really didn't have an understanding. They didn't really have any evaluation, and there's really no way to evaluate in the way that they've implemented the program, whether it would be cost effective. And so if you're interested in reading more about this cost effectiveness study, here's a QR code for the preprint. This is under review as well. And to summarize and add some additional layers of what we're working on related to wildfire smoke communication and protection is, as I mentioned early in this presentation, there's still a lot of data gaps in understanding the links between this episodic wildfire smoke exposure and chronic disease. We know that it has acute effects on people, including people with asthma, increasing their exacerbations. But how does that link to chronic conditions? There's still a lot to be learned there, as well as a lot to be learned on how to improve the messaging and reaching people, and for people to implement the results or implement the public health advice. So continuing to apply for grants to further understand the connections between wildfire smoke and health-related consequences. Additionally, there's been interest to adapt and expand that cost effectiveness model that I just really very briefly went on, and I'm hoping people don't ask me too many questions. I am not a modeler. I can answer some high level questions on that model. But looking to other disease states and incorporating equity related issues. So this was something that was identified by government partners that we engaged in this project. At the time we were doing this model, it was there weren't really any data sources that we were able to easily match to the wildfire smoke measures. And then develop a model that projects into future years. So wildfire smoke is very episodic, and so it's actually really challenging to project it into the future of when and where and how much will happen. So in this current cost effective project, we looked retrospectively from 2015 to 2019, I believe. And then other types of work that we're doing that I just want to highlight here is, I know this is a public health, but we did it with healthcare providers, and what the role of healthcare providers is in counseling patients on wildfire smoke, particularly people with respiratory disease. So there's a publication here on the left side, QR code if you're interested. We did a survey in Williams Lake in the summer of 2021 to understand healthcare providers' perspectives on counseling patients about wildfire smoke. And then lastly, I'll just highlight Dr. Emily Brigham. She's a respirologist with Legacy for Airway Health at UBC, and she has developed a wildfire smoke and extreme heat action plan. If you are familiar, there is something called an asthma action plan, which is kind of like if-then statements for patients to self-manage. And so we've adapted this idea to a wildfire smoke and extreme heat action plan so people can help prepare themselves for wildfire smoke. And this was aimed to support a client and clinician interaction. But we've spoken with folks at Vancouver Coastal Health, and we're working on expanding it to more of like a community setting. And we pilot tested it in VGH and in the Ontario Health Authority this past summer. So we're doing some adaptations to that. And if you want to learn more about that, the QR code on the right. And so we continue to work in this space, and I just wanted to highlight some of this work, and maybe something that not everyone considers when we think about public health is the other side of how the public is actually receiving and understanding and able to implement this information. Particularly related to wildfire smoke, we have these really big peaks, but we know that PM 2.5, the main contributor to wildfire smoke, there's no lower safe levels. So trying to message that risk can be challenging when, on days where we can see the smoke, we know that it's bad, but on days where we can't see the smoke, it might still be bad. And how do we message that appropriately and for different types of people? And so I'm just going to stop there and say thank you very much, and we'll open up to questions, I think. And I think I'm going to stop sharing that.